Good morning, students. Good morning, teachers. We're so happy to have you with us. Welcome.
You can hear us.
Good morning, everyone, and welcome. Today is May 25th, and we're wrapping up our school year with a Better Hearing and Speech Month. Did you guys know that this is Better Speech and Hearing Month? And I want to welcome Isa Carmago. She's a speech language pathologist with DHR Health. I want to remind you that this session is being recorded. So if you have any friends who weren't able to join you here, we're going to send out the YouTube link later and they'll be able to watch that. For now, we're just going to talk to Isa for a bit. And then later, I'll give you an opportunity to put questions for her in the chat. So be thinking of things that you might want to know beyond what she's talking about. So I want to welcome all of our PATHS students to Cybermentoring today. And I want to introduce you to Isa Carmago. Hi, Isa.
Hi, good morning, everyone.
How are you doing today?
I'm good. Thank you for having me.
Good. Tell us a little bit about yourself.
So my name is Isa Carmago. I'm a speech language pathologist here at DHR. I currently work at our inpatient rehabilitation hospital. I've been practicing for 17 years and I graduated. I got my undergraduate and my graduate degree here at University of Texas when it was called Pan American. Now it's UTRGV, but I graduated from here locally.
Where did you go to high school, and tell us a little bit about when you went to college and some of the classes you took and that experience.
Oh, high school, I'm from McAllen, so I went to Nicky Rowe High School. And I started going to Pan Am. We took classes like, you may take classes on normal language development, language disorders in children, specific courses on articulation, and neurological disorders. We even take classes on hearing impairment and sign language, classes on voice disorders, swallowing disorders. So that's kind of what our coursework looks like.
Okay, tell us a little bit about what you do on your job.
So in the inpatient rehabilitation hospital, we typically work with adult population who maybe have suffered a neurological event. So we work with patients who maybe have suffered a traumatic brain injury. Maybe they were in a car accident or they had a fall. We work with patients who have suffered a spinal cord injuries, stroke, maybe someone who has Parkinson's disease, things like that. People who have disorders with speech or swallowing, maybe they were intubated or they had a surgery and they're having difficulty swallowing. So we help to rehabilitate those functions. And in rehab, we work as a multidisciplinary team. So we work really closely with our doctors, our nurses, our CNAs. We work with the physical therapists, our occupational therapists, our respiratory therapists, our dietitians. So we work as a team approach. And we really collaborate daily to make sure that we're providing, the best care for our patients.
That's great. Tell me something that you really like about your job. What's your favorite part of your job?
Oh, there's so much. Definitely it's rewarding, right? This is a profession where we're helping people, we're meeting their families, we're helping them to improve and get back to their prior level of function. So that the rewarding part is the best part of it. The great part is that there's so much to do in our field. It's very diverse because and in our field, we can work with so many different populations. You know, you can work with the babies that were just born in the neonatal intensive care unit. You can work with the pediatric and adolescent population in the schools or in clinics. You can work with the adult and elderly population. And then in so different settings, you know, you can work, like I said, the schools, there's outpatient clinics, there's private practice, there's skilled nursing facilities. And then especially us, where we kind of specialize in the medical SLP, you know, we work in a hospital system.
Well, every job has its challenges. So tell us some of the challenges you face in your occupation.
Challenges. I guess one thing, and because it's Speech and Hearing Month, we're constantly, I guess, providing education and awareness. You know, our title is Speech Language Pathologist, but we do so much more. You know, our scope of practice, of course, it entails speech, language, hearing, swallowing, voice, AAC, where we use these communication devices, cognition, resonance, fluency. So it really is a constant education, because our title a lot of times does not encompass all of those areas that we work with. So if you're an SLP, you always will go through or always receive the comment when you walk into a room and you say, "Hi, my name is Isa, I'm the speech language pathologist." Sometimes we get the comment, "Well, but my speech is fine." You know, and we have to educate. Yes, your speech does sound great, but we also work on, you know, cognition and swallowing and voice and fluency. So that I would say is a challenge, is the constant education.
I understand that. Yeah, I can see where it may be misinterpreted what exactly you're there for. You talked about technology, and I know that our students are always interested in the technology that's used in different healthcare fields. So what kind of technology do you use in your field?
Technology, we have, and I brought this, it's very big.
Yay. We lost you. There you are. That's good. Well, students, I think we lost Isa for a second. So let's see if she comes back in. I want you to get ready. We're going to put some questions, allow you to put questions. There she is. We're going to allow you to put questions in the chat in a few minutes after I finish talking to her. Are you there, Isa? Oh, Isa, wait a minute. Oh. Isa, you can unmute yourself now.
Okay.
There
I'm
you
back.
are.
Can you see me?
Yes, we can see
I'm
you.
so sorry about that. Okay.
This is technology. That's what happens.
So one of the things that we use is, you know, we called AAC devices. It's an alternative communication device. So this is something that we use for our patients that maybe understand what they want to say, but they have difficulty expressing themselves. So we oftentimes use these devices when they have that type of aphasia. And it's like a computer, and it's got different screens to where they can go to, "How's it going?" And they can push the button and it kind of speaks for them. So there's different pages, there's quick fires, there's icebreakers, there's things for personal care if they need help, you know, whether grooming or hygiene, things like that. And these devices also have technology of an eye gaze. So that means, you know, patients that may have like Lou Gehrig's disease or ALS, and they lose function in their hands and they're not quite able to touch the screen, they can use their eyes And when they look at the icon, they blink and it speaks for them.
Okay.
So that's one technology that we use.
That's very cool.
As far as like other like equipment, we use like a vital stim therapy, where sometimes we place electrodes maybe on the throat area where we're trying to improve, muscle strength here, or maybe on the face if they have a facial droop from a stroke, we may do that. A lot of times people don't know that we also do diagnostic exams.
Mm-hmm.
So when we have a patient who has a dysphagia, a difficulty swallowing, we're able to take them to radiology, and we actually do a swallowing x-ray where we actually see a side view of the patient, and we mix different food consistencies and liquid consistencies. And as we're administering them in the x-ray along with the radiologist, we're able to see if the food is passing to the esophagus and stomach where we want it to go, or is it passing to the lungs and they have an aspiration. And in those exams, we figure out why it's happening and what type of exercises we need to do to improve it.
Oh, okay. That's very interesting. I know that students, they're very interested in technology and they always ask those questions. So what I'm going to do now is I'm going to open up the chat for students and teachers to ask questions. It doesn't take very long for them. So students and teachers alike, if you have questions for Isa, you can put it in the chat. And I'll go through and start asking her the questions that you have. Let's open it up. No questions yet? Well, tell us a little bit more about your education, because I know that that's something that students are very interested in. How did you become interested in going into speech language pathology? What sparked your interest?
What sparked my interest? I think just the, you're working in a healthcare where you want to help people, and just the fact that it had so many areas that you could work with of populations and settings. But what interested me the most was the medical part of it.
And when did you start becoming interested?
I believe right after I graduated, I really knew what I wanted to do. So I began working towards that. So as soon as, you graduate from high school, you start getting your undergrad. We get our bachelor's degree in communication sciences and disorders.
Okay.
And then from there, you have to earn your master's degree in communication sciences and disorders. So it's a 6-year program. We have to do about like 400 plus of clinical work or hours and experience of our externships and all of that together. Then from there, we have to pass a national exam. It's a praxis exam. You have to pass with the acceptable score. And then from there, once you get your master's, you have to complete what they call a CFY. And that's, it's a clinical fellowship year. So that's where, you've already graduated and you start working, but you start working for 9 months under the supervision of a speech language pathologist. That way they can continue to mentor you. And then after the 9 months, you obtain your C's, which is the Certificate of Clinical Competence.
Oh, okay. So if a student may not want to go to school for that long, are there other ways that they can enter speech language pathology or work with patients having some type of certificate or a lower degree, maybe an associate's? Are there other programs that they can go into?
Okay, so there's no associate program, but there are some individuals that maybe obtain the bachelor's degree. And then with the bachelor's degree, that would make you a speech language pathology assistant. You would work at the assistant level, under the supervision of a speech language pathologist.
And so that would be for how long?
That's a 4-year degree.
A 4-year degree.
But
Go ahead.
so at the assistant level, it's a little bit different. It's a lot more of treatment. You're providing therapy services, but not necessarily evaluation and diagnosing that we do. So it's kind of like the speech pathologist would do the evaluation and diagnose and come up with a treatment plan. And then that's where the speech language pathology assistant would take over with the treatment, the therapy part.
Lost the hearing and we're having technical difficulties today. And I wasn't able to hear in my my AirPod in this here, so I had to put this one in.
Oh, did you want me to repeat that?
Did you see if this works?
Oh. Oh, can you hear me now? I see the question in the chat of, does a speech language assistant need a specific bachelor's degree?
There, and I can hear it now.
Typically they do earn a bachelor's degree in conveyances and disorders, but there are new programs where they may get a bachelor's degree in another area, but then they also have to take specific core requirements that go towards the communication and sciences bachelor's. And typically, if people go through that route of the assistant level pretty much might work in the school systems or maybe a home health under supervision, but not at the hospital level.
That was the other question that I had was, you're in a hospital and you work in that setting. And I know that my grandson goes to a clinic and there's a speech language pathologist there that helps him. But where else might you see a speech language pathologist work?
So again, like in the neonatal intensive care unit, there's outpatient clinics, like you mentioned, where they have, they offer all 3 different types of therapies, right? School-based, there's home health, there's skilled nursing facilities, there's hospital settings. There's all different types of clinics that also specialize in different areas. Like there's outpatient clinics that may specialize in seeing patients that have autism or Down syndrome. So there's also a lot of specialties in our field where some people may specialize in like swallowing disorders or voice. Me specifically, I'm a certified brain injury specialist, so I specialize in the brain injury population.
So we have a question. What made you want to do this line of work?
So
was there
same
any
thing.
Event?
Not really. Not really a specific event. But I just like that fact again, that you can work with so many different populations and so many different settings. So there really is a place for everyone and a specialty for everyone. And that's what made me, focus on that field. But I always knew that I wanted to be part of the medical aspect of it.
So I know that no one in particular works on their job all by themselves. So I'm sure you work on a team. Can you tell us a little bit about who would be on a team and who would work with you and what it's like to be part of a team at the hospital?
So again, our team, specifically in rehab, we work really close to our physicians, right? Our physiatrists. They're the ones that will give us a consult and they'll say, we want you to see this patient. They just, had a brain injury and I want you to check for their swallowing. We work with the physicians. We work closely with our nurses to see if there's medications that maybe would cause a side effect, or what diet are they on. Our CNAs, our respiratory therapists, are they on oxygen? Do they need to be monitored? Do we need to take their vitals? We work with the dietitians to make sure that their food texture is correct, like we recommend, because we want to make sure that our patients are swallowing safely. We constantly work with our physical therapists and our occupational therapists daily, because we want to make sure that we're all on the same page, we're addressing the same issues, we're talking to our families, and we're providing, you know, that best care. Our case managers are also key in our team. They work on our discharge planning, they work on, you know, getting the equipment they may need, even psychiatrists, psychologists. So we're part of a big multidisciplinary team.
Right. What is the process that required an SLP to be called in for a patient? And does the nurse perform a focused neurological assessment and then recommends the provider the SLP that should be involved? Or what's the process that a nurse would go through to pull?
You know, the nurse may see that a patient is having swallowing difficulties, like maybe they were administering medications and they noticed the patient coughing and choking. So we're the specialists in the swallowing area, so we may get a consult for that. Or the nurse may notice a change in mental status, you know, so-and-so in room, you know, 502 seemed really confused today, or maybe it's not oriented. And we would go and do a cognitive assessment, a formal evaluation. Maybe somebody who has paralysis or like a facial droop and is having trouble managing their secretions. Those are things that our nursing staff would look at, and then we would be consulted. Or difficulty speaking, their speech is slurred, or he tried to say something and I didn't understand him, or he's trying to tell us something and he can't get his words out, or, you know, those would be kind of red flags that they would look at.
Right. And can you tell us about the different populations that you work with? Because I know students are always interested in that. Like, how would care for a child be different than, say, a geriatric patient?
Mm-hmm. So starting with the neonates in the neo intensive care unit, that's a question that we get often when we say we're the speech language pathologists. They say, oh, but they're a baby, they're not talking. In that area, we work on their swallowing. We work on the babies coordinating their breathing, their sucking, their swallowing pattern. Do we need to change their position? Do we need to change the nipple of their bottle? So that's that type of setting. And then for pediatric population, it may be, you know, school-based or clinic where they have trouble pronouncing certain sounds, or they're not meeting those developmental milestones. They're not speaking in phrases and sentences like they should at that time, or they're delayed. Or maybe they have trouble with, you know, their pragmatics or social. Maybe oral motor, you know, they have weakness here where we need to work on exercises that they get more movement in their articulators. For children, children that have, that were born with, you know, Down syndrome or cleft palate. Mm-hmm. Those are populations we work with in the pediatric. Adolescents too. We may work with hearing impaired also, in all ages. Mm-hmm. Our elderly and geriatric populations, we see more of patients who have suffered a neurological event, right? They suffered a traumatic brain injury. They had a fall, they hit their head. They're having issues with their memory, their concentration, their sequencing, their thinking, their reasoning. their insight, or it may be someone who suffered a stroke, or someone who was diagnosed with Parkinson's disease. We see things like that, or a spinal cord injury. So those are diagnoses that we would work with.
So we're at the top of the hour, and I'll tell you what I know usually happens during Cybermentoring is we have new students who come in. Some students have to leave because they change classes. So can you give us a little bit about your background on your education again, and what courses did you go through? What was your course of study to become a speech language pathologist?
Mm-hmm. So again, you graduate from high school, you start college, you start your undergraduate degree, and once you get your basics, then you start focusing on courses like normal language development. We may look at courses that focus on disorders of language, voice disorders, neurological disorders, special populations like cleft palate and different types of syndromes. And then we do courses on dysphagia and swallowing disorders. So once you earn your bachelor's and your master's degree, that's a total of the 6 years, right?
Mm-hmm.
Then you do a bunch of observation hours, and you have to do your externships. Then once you graduate with your master's, you have to take a national exam. It's called the praxis exam.
Mm-hmm.
You have to pass that. And once you pass your praxis exam and you start working, it's a 9-month clinical fellowship year where you're working under the supervision and mentorship of a speech language pathologist, for that 9 months. And when you complete the 9 months of your clinical fellowship year, then you are awarded with your Cs, which is the Certificate of Clinical Competence.
And when you get that certificate, then you can work anywhere in the United States, or is it state specific?
You can, as long as you apply for your license in that state.
Okay. Okay.
So we go through the Texas board, and we apply through the Texas board, and then we can practice in Texas.
Mm-hmm.
But you can practice worldwide. Well,
I know these are the favorite questions, so I want to make sure any new students that joined us,
mm-hmm.
They ask the same question. They always have the same type question. What do you like best about your job? What's the best part of your job?
The best part, of course, is, we're helping the patients regain this function of their speech and their swallowing. And of course, communication is essential, right? Everybody has a right or a need to communicate. So we're helping them gain that back and gain their swallowing and their cognition, getting to know our patients' families. And then, of course, working with our team daily.
Mm-hmm.
So that's the best part. We're working in a team. Yeah.
Well, I can tell you how a student would say it, but I'll say it differently. A student would say, what's the worst part of your job? But I'm going to say, what are some challenges you face when you're on the job?
Challenges, I would say I would go back to that. We're constantly educating, but it's not something that's just so easy. It's challenging. It takes hard work. It takes a lot of sacrifice when you're in school. So it's a lot of hard work to get to that point of being the SLP, but very rewarding.
Yeah. Students, you have the opportunity to ask questions in the chat. So if you have any questions for Isa, and for those of you just joining us, Isa is a speech language pathologist with DHR Health. And in case you didn't know, May is Better Hearing and Speech Month. So we're happy to highlight speech and language in the month of May. I know that a lot of you are getting ready to finish up the school year and take a break this summer. One thing that students look for, Isa, are opportunities to do internships or volunteer work in the area of that we're highlighting for this month. So is there anything, if they're interested in this, that they can do this summer to prepare themselves to go into speech language pathology?
I know that our hospital does take volunteers, but specifically to our area or department, we typically start getting students when they're about to apply for graduate school because they need certain amount of observation hours.
Right.
So we see more students that are at that level,
At the
getting
Yeah.
ready to go into the graduate where they need those observation hours. And then of course we always take students that are already at the graduate level and they're doing their externships. So we're actually having quite a bit of students with us this summer.
About how many students do you usually have? Well, this isn't an unusual summer. This is probably getting back to being a usual summer.
Yes,
so
it
how
is.
many students, and this would be undergrads getting ready to finish, correct? And they have
actually,
observation, and then grad students who are putting in their 9 months. How many students do you expect to have this summer?
Well, the graduate students that we get, they have to complete externships. So usually they may be assigned a pediatric site one semester, and then they may be assigned to an adult or hospital site the following semester. So the students that we're getting this summer are doing like a 4-week rotation. So I know I'm getting one in June and one in July, and also our speech pathologists in the acute care are also taking students. But those students are already getting ready to graduate with their master's degree.
Okay. So they don't just stay in one area the whole time. They get a chance to see all the different areas to work in. Well, that's good.
You'll definitely be exposed through the coursework and through your rotations. And then from there, you get to pick which setting and population you like the best.
Well, that was my next question. So do most speech language pathologists stay in one area, or when you're working, do you specialize in pediatrics, or do you specialize in adolescents, or do you find that you're called in on lots of different areas?
I mean, you have so many options. There are people that may work, PRN, like they may work in the schools in the morning and then go work in the hospital in the afternoon. And then they may
You'll have to tell students what PRN means.
PRN means like as needed, so you may work in the school in the morning, and then if they need help in the afternoon, you may work in the hospital if they need help, and then you may do home health visits on the weekend. So I think when people graduate, they kind of already have an idea of where they want to work. But there's so much diversity of what you can do in the field.
So if you're in one area, and let's say during your career, you decide you'd like to go to another area, that's possible. Yeah.
That's very possible. Yes.
So students, I want to remind you that you can put your questions in the chat. I think we're down to very few students, so I want to give them just a few minutes before we close out the session. And I don't see any. I'm trying to practice what's called wait time. Teachers don't usually do that, where you ask a question and then you wait to see. But I think we're getting towards here's a question. Oh, no, that's not a question. Kavian, with so few students, one thing I can do is allow you to unmute yourselves. So if you want to unmute yourself and ask a question, you're more than welcome to do that. Or if you'll look, you can raise your hand and ask a question. So let me give them a few more minutes. Because sometimes, as we experienced our technology problems, sometimes students have technology problems. Kavian, did you have a question?
No, was an accident.
Okay, that's fine. Don't worry about it.
Okay.
Does anyone else want to unmute themselves and ask a question? I think we're good then. Isa, thank
Good.
you so much for joining us today.
Thank you so
We
much.
appreciate your time and giving us all the information you have. And remember, students, if you want any other information, that you can contact anybody on the PATHS team, and we'll be happy to answer that for you. Thank you so much.
Thank you for having me.
Bye.
Have a good day. Bye-bye.
Bye.
Bye.